Welcome to Cyprus Facial Surgery. Welcome back. This is Monday morning. We're here outside of my operating room. I'm ready for a war. I'm ready for my facelift. I'm so excited because I love this. And you can see here, I put all my weapons, my hat. This is American Academy of Cosmetic Surgery, my mask. I kept staring, and of course, I'm opening the door of this beautiful operating room, and the patient is ready for our new style facelift. Keep following us. I'll come up and I'll show the final results of this patient. This is Dr. Neil here from Cyprus Facial Surgery. Ashton, welcome from England, right?
Yeah, I'm near London.
You're in London?
Near London,
Near London, okay.
Yes.
And you flew all the way here to Cyprus for your actual facial rejuvenation, right?
Yes, I did a lot of research and I came here in February to see you, and as I say, I don't do things lightly, and I've researched Dr. Dimitri Ardis, I've watched his YouTube videos, I've read his credentials, and he's the man to do my treatments, because there comes to a stage in your life where filler doesn't do what you want it to do, and I need something to help me, and I don't particularly want to go under general anaesthetic, and as I said, I've seen his results, and I want to look fresher, younger, without being stretched.
So you flew all the way through the COVID to see us here in Cyprus?
Yeah, so even though it's COVID time, and I paid in London to have a COVID test, I crossed lots of hurdles and barriers, and I was determined to get here. I even broke my ankle, and I'm still here. That's how determined I am.
So since you want it so much, tell me, what is the things that you don't want to see again in your face? What are the things that now the fillers and the other actual non-invasive procedures cannot help you anymore, and you took a decision to say, yes, let's go for this procedure?
Okay, well, the jowls, they need to be lifted and pulled back, and filler can't do that. I've got hollows under my eyes and I use concealer all the time. I've had filler before, but again, that doesn't last. And obviously I've had Botox in the past. I've had nothing virtually for 2 years because I want my face to be ready for surgery. I need to be lifted basically, and filler can't do that.
All right, and you're here for this new procedure, the newstylelift, right? The procedure we do at the local anesthesia, which is a deep plane facelift, actually, deep into your tissue, which will last permanently. It will actually be less aggressive with a short recovery. And I'm going to tell you now what I'm going to address. If you turn on the side to the camera to see, you can see here what we have here. We have all this area that is being pulled down, all right? And we have this big area of skin that is pulled down. That's because of the deep plane of tissue that is pulled down. And you see there is no definition of the jawline. There is this area here that is actually the jowling. There is all this area here of the neck, that is excess neck. The chin throat angle is being obliterated. The mandibular jawline is being actually lost here. And of course you can see the deep nasolabial fold and the poor definition of the cheeks. So what we're going to do here today, through an approach that comes into your ear, into your hair, and behind your ear, I'm going to approach your face. I'm going to lift up the face. I'm going to lift up the cheeks, and you asked me before if I need to put some fat. Sometimes yes I do, but in your case, if you have a very good definition, I'm going to elevate the fat parts from the area of the anterior zygomatic prominence superiorly, and I'll give you more natural and aesthetically looking mid-face with the lift without the need of getting any more actually fat grafting. And of course, we're going to do a chin, and a neck actually lift by opening up here and taking the platysmal muscle and tightening that up. That's going to be here in the office with local anesthesia, okay?
Yeah, I'm happy with that. I'm really excited.
You're going to go home afterwards, and we're going to come back in a week, and we're going to show all of them your amazing results and you back to your normal activities.
Yes, yeah. And I want to say, everybody, I wear this around my neck because I'm really conscious of my neck. So for me to not have to wear a little necklace to hide,
I don't believe you're going to need it again.
Will be great.
Thank you guys, keep staying with us. I'm going to show the final results in a few hours, and then in a week I'm going to come back with this new style facelift, the new technique, this innovative technique, the pioneer technique that can give you permanent results under local anesthesia in a few hours and 1 week of recovery. Thank you very much, stay with us, we're going to come back, we promise to give you the results. Welcome to Cyprus Facial Surgery. We're here with our patient 2 weeks after actually a facelift, and what you can see here, you can see the very nice delineation of the face. It's just 2 weeks what we've done here. We still have some swelling here, but what you can see the very nice area of the neck, the chin-throat angle that has been, you turn your head towards me a little bit, you can see the chin-throat angle that has been actually corrected. All this fullness of the neck has been gone. On the other side, you can see clearly the jawline that has been corrected. There is still some swelling on this area, but you can see the elevation of the cheek, the jowling that has been actually removed, and of course the very nice contouring in the face. Even in 2 weeks, you can really see and appreciate a huge difference in this patient. Let's go to the patient and ask the patient how she feels today.
I feel great. I'm extremely happy with the treatment and how my face looks. I'm absolutely actually amazed. I really am. As I said, I've done lots of research and I don't think I'd come to anybody else apart from Dr. Dimitri Ardis and his great team. I know my face is still slightly swollen, but it's going to look great. It looks so much better. I didn't even have these facial contours when I was a young girl. So I'm going to look better now than I probably did then. And I'm in great hands in every way, and I'm extremely pleased with this. Wow, my neck is amazing. I've actually got great cheeks and I've got a really good definition, which I've never really had. So I'm really amazed. I'm really pleased. I'm really happy. It wasn't painful. Yes, I'm swollen, so it's still not looking as it will look.
Definitely. And Annabelle, you're here in Cyprus for about 2 weeks now. Can you tell me how was this post-operative time? How you got this time? You got in the house, you're locked. Did you actually manage to go for shopping? I think you had some other start treatments even after the surgery, right? So it doesn't, how you feel?
Okay, so basically, I didn't stay in hospital. I had the surgery. I had it done during the evening. I went home. The next day, I was able to eat some breakfast. I wasn't very easy, but I could. I wasn't in pain, and basically I was able to do everything. So I've been here for 2 weeks. It hasn't stopped me going out. It hasn't been painful. It's just the swelling. Obviously, I disguised my face a bit with wearing glasses and a hat, but it hasn't stopped me doing anything, basically. I've been on my own as well. I haven't had any help. I've come from the UK. I'm on my own, and I can go shopping and I can get food for myself. I can look after myself. I've had no problems whatsoever. The surgery hasn't stopped anything. And also I've had some dental treatment while I'm here as well. So.
Annabelle, thank you very much. We're very pleased to have you as a patient. That's what we do here in Cyprus Facial Surgery. Thank you very much.
Hi ladies, British ladies and British guys. I just want you to know that I really did my research before I came here, and Dr. Dimitri Ardis is somebody that is brilliant because he's a surgeon that just works on the neck and the face. So he knows it all really well. He's a maxillofacial surgeon as well. So he knows the jaw area, he knows all the nerves. So that is why he's able to do this surgery. I didn't have to go under general anesthetic and I had a facelift. Now, there's not a lot of other surgeons that can do this because they don't know the nerves. They can't go this deep. He can, and it's very safe. And you do not have general anesthetic. So this is why he is so good. And he's not working on other parts of the body. He's a specialist in this area, which other surgeons, they don't do this area all the time. They do other areas too. So I wanted somebody that knows the face and does the face all the time. And that's why I chose Dr. Dimitri Ardis, and that's why I came here, and that's why I'm sharing this with you.
Thanks everybody for watching, much appreciated. If you like this video, click the thumbs up button. For more information, check out these links. And if you're new to our channel, please do not forget to subscribe and to turn on your notification with the bell icon down below to get all of our new updates in your feed.